Tonight, the request was perimenopausal symptoms, and I'm sure no one here knows about that better than the single male who's representing all of us. Luckily, Jacob didn't respond, so that's good. So, perimenopausal symptoms, all right? What is menopause? What is andropause? Let's just talk about that for a minute. What is menopause?
A headache.
Okay, what else? A hot flash.
Hot flashes.
Right?
Cold sweats. Yeah.
Cold sweats. What else is menopause?
Moodiness.
Moodiness. Thank you. See? There it was.
Yeah.
Anybody else? What is menopause?
Hormones change long enough to stop your period for at least a year.
There you go. So the clinical diagnosis is menopause is 12 months continuous no period. So how old do you have to be to have no period? 12 months. Any age. Okay? Pretty alarming though when you're in a childbearing age and you no longer have that. Okay? So when you look at this type of a presentation, what is it? It's a change in the hormones. So again, we'll use a symbol like this for change in hormones. And typically it is when the estrogen and the progesterone balance becomes imbalanced. We no longer become gonadal dominant, or the pituitary communicating to the ovaries no longer produces adequate amounts of hormone to stimulate a normal cycle. And what's a normal cycle? A normal cycle is called a cycle because just like the moon, it has a cycle, right? So there's a presentation where, in essence, tissues are growing, they respond to hormone, and then once the hormone stops, then there's a sloughing of the tissues, okay? So in order to actually have a menstrual cycle, we have to have a spiking of follicle-stimulating hormone. Follicle-stimulating hormone leads to a spiking of another hormone we call estrogen. An estrogen spike leads then to a luteinizing hormone spike, and luteinizing hormone spike then will cause us to have a progesterone spike. Okay? So that is the normal hormonal cycle. And each one of those hormones responds because of another hormonal spike. In order to have an estrogen spike, I have to have an FSH spike. In order to have an LH spike, I had to have an estrogen spike. In order to have a progesterone spike, I had to have an LH spike. Okay? If the body doesn't have those spikes, what happens? There becomes a lengthening of my period. And so we'll see a presentation where a woman will start to have a period that goes greater than 28 days. And most commonly, this then becomes a progesterone lack. Okay? Remember, we've talked about before, in order to have a luteinizing hormone spike with a progesterone follow-up, we have to have our prolactin levels low enough that there can actually be an LH spike as well. Prolactin becomes a stress hormone. And that stressor hormone then, prolactin, is actually a response as we look at our adrenals and adrenal exhaustion, adrenal fatigue. So we've talked about that quite a bit in the past. Okay? So when we look at perimenopause, we're really looking at a changing or a lengthening of this cycle. Let's talk about a few things that can create that lengthening of the cycle. Any questions to that point? Everyone okay? Bless you?
Now, but the FSH also comes from pituitary, thyroid on down, right?
FSH is follicle-stimulating hormone, which is different than TSH, which is thyroid-stimulating hormone, which stimulates the thyroid.
Right.
Follicle-stimulating hormone comes from pituitary, yes, and then works at the ovary where estrogen is produced. Okay? Luteinizing hormone is produced at the pituitary and then works again at the endometrium where the progesterone is produced. Okay? Clear? Very good. Very good questions, though. So, oftentimes, let's actually stay there for just a moment. Oftentimes, then, physicians will take a look at our estrogen levels and our progesterone levels and see that one or both or testosterone and DHEA levels are also low. And what do we get then? A nice bath of hormone, right? Oh, we did a hormone test and it looks like your progesterone's level is low, so here's a nice little cream. Oh, your estrogen's level, here's a little troche. You can take this orally, or we'll give you a suppository or even a cream, right? That you can go ahead and take care of that dryness. That'll fix that. But in our opinion, what we found is if we can actually functionally improve the hormonal response by stimulating then either the precursor or the postcursor, if you will, to these hormonal presentations, then we can actually maintain the body's normal function. Okay? So in other words, we try to look at the hormonal replacement not as a replacement, but from a functional perspective at the organ that is potentially failing. Okay? How many of you know someone who went into menopause and never had a hot flash? It was fine.
My mom.
My mom, yeah.
Yeah, she
Not a problem.
said regular.
Yep. Somebody else? You know somebody? My mom. Okay. No problem. Went right into menopause. It's like one day I was fine. 12 months later I realized, wow, not pregnant. Nothing happened. Right? So some people respond beautifully. And that's actually the way it should be. Okay? As these hormonal responses change from the gonadal response, there are two amazing glands that should kick in and take care of the rest. So let's see if we can get a volunteer here for just a second. When we look at the body, atop the two kidneys are these two amazing glands we're referring to called the adrenal glands, right? Normally, there are two little ovaries in the female reproductive system that in essence will respond to the hormones coming from the pituitary itself. So when we look just briefly, the pituitary will actually produce a hormone, and that hormone is released from this little master gland right behind the eyes. Okay? This little guy releases TSH, which will respond here at the thyroid in the front of the neck, which will then cause T4 release and activation or conversion in the liver to T3, 60%, and in the gut, 20%. Okay? Then we look at the follicle stimulating hormone that is also released from this, and this FSH is going to come down and respond here and activate the gonads. Okay? Which will then cause estrogen production. Luteinizing hormone then is released, which will cause then progesterone production. Now, when my body kind of runs its little cycle, and after so many years the little clock ticks away, and it says, you know what? You don't have to do that anymore. Then what happens is, these hormones start to decrease, and these glands become less efficient, and these little glands should kick in. Okay? The adrenals have the ability to produce testosterone, estrogen, progesterone, and DHEA. And those who just sail into menopause, no problem, not a hot flash, are the ones that have very healthy adrenals. Now, how healthy are the adrenals of most of the people in our society? Not very healthy. Okay? So consequently, just like you say there, Amy, crud. You got to get those healthy before we get to that point. Alright? So healthy adrenals are actually the key for the body to maintain hormonal levels so we don't suffer, in essence, the consequence of hormonal lack. Right?
So why, if your adrenals kicking in and produce those hormones, why do you still not have a period? And I mean, if you still have the hormones.
So the question is, if these hormones are still present, why do we no longer have a cycle? Correct? Because the levels of hormone are not adequate to produce then a cycle. We have adequate amounts now just to maintain tissue health, to maintain gender identity, if you will, right? to maintain then brain response, to maintain liver integrity, to maintain female organ integrity, to maintain male hormonal integrity. All right? So it takes over then, instead of having this complete cycling, now we have adequate amounts just to maintain healthy tissue function. Does that make sense?
Yeah.
So it's no longer has the need for the cycle, because the purpose of the cycle is to propagate the species, right? The purpose of this cycle is to be able to procreate. And once you've passed through that loving, nurturing, mothering stage, and you get to the loving, nurturing grandmother stage when you can send them back home, right? Ooh, I'm tired. Then we change that cycle. Very good. So that's what we're looking for in that presentation. Everybody clear to that point? Everybody okay to that point? So when we look at perimenopausal, meaning I haven't gone to full menopause, but I may be skipping my periods, or my periods may be lengthening out, what is really the biggest key that we're looking for? What is a key to maintaining healthy hormonal function?
Adrenals.
Adrenals. You've heard it before, haven't you? Okay?
Oh, it's starting to sink in.
It is. So let's look at what these adrenals do to help to reduce the burden of perimenopausal symptoms. First of all, when we look at the perimenopausal symptoms, so many people get confused by some of the symptoms of menopause. Okay? Hot flashes are a symptom of menopause. Night sweats are a symptom of adrenal fatigue. Okay? So night sweats are an adrenal problem. Okay? Disrupted sleep is an adrenal problem. I wake up, my clothes are soaked, my nightgown's soaked, my sheets are soaked. I feel like I have to change the bed in the middle of the night, not because I wet it, but because I sweat it. Okay? That is adrenal fatigue. And that is one of the primary drivers of perimenopausal, pre-perimenopausal, or early perimenopausal symptoms. How many of you know somebody who has infertility and they're only 30 years old? Or somebody with infertility only 28 years old? Or somebody with infertility only 26 years old? Or someone who's never even had a child and they're only 22, 21, they got married, they're excited, we're going to have kids, and nothing happens. Anybody know someone with that? Yeah, it's becoming more and more and more common, isn't it? So when we look at this, adrenal function and adrenal health is one of our primary keys to maintain a healthy cycle. Okay? The adrenals have several responsibilities, and we've talked about these several times before, but let's just review briefly what is it that the adrenals do that are so important to us. Okay? Number one, the adrenals help to maintain our blood sugar during a fasting state. How many of you know somebody who has hypoglycemia? Not hypoglycemia. Anybody know someone with hypoglycemia? One of the most common afflictions of women, right? I don't eat, I feel jittery, my irritability is relieved by eating sweets, I crave sweets. Those are blood sugar imbalances. Cortisol is the specific hormone that during the night should be kicking in, and it has a rhythm or a cycle just like the other hormones do, only it's a nightly cycle. This one we can actually measure, as cortisol should be highest at 8 a.m. Then as we eat throughout the day, it should be going down in its concentration such that by 12 p.m. at night, or 12 a.m. at night, it's at its very lowest. Then as I go into this fasting state, I haven't eaten for several hours, it starts to increase again, such that then by 8 a.m. it will spike again. Okay? That's normal cortisol function, normal cortisol rhythm. But what happens in our society? I'm way too smart to eat breakfast, right? Or I'm in too big of a hurry, I gotta get the kids out the door. My husband has to get out, and all of a sudden I'm running out the door too, and it's 2 o'clock before I realize, oh, I need something to keep me going. I haven't eaten all day. So what happens is our cortisol level now has to stay high for a longer period of time. Okay? And then what happens is now my wake-sleep cycle starts to change. So now I feel extremely lethargic in the morning, and I finally kick in at about 10 p.m. when everybody's trying to go to bed. I finally get bright-eyed and bushy-tailed. Why is everybody going to bed? Or I can get all my work done. I can do my laundry at night. Everybody's asleep. It's quiet. It's my time. And now I'm awake. Okay? So now